So I'm just doing my best.
You're trying. That's
Mm-hmm.
what matters.
Yep.
Okay. Hello, everybody. Welcome to the fourth episode of Dizzy Directors. My name is Lauren Clark,
My name's Tori Mosser.
and on today's episode, we have Catherine, who is a classmate from my school at Sarah Lawrence, who also has POTS. So, Catherine, you can go ahead and introduce yourself, kind of talk about yourself, what your experience has been like with POTS, and all of the cool, fun stuff you're doing.
Cool. Hi all. My name is Katherine McCrackin. I am a multiply disabled person, POTS and openly autistic. The two frequently go hand in hand. Let's see. I got diagnosed with POTS a little under a year ago and developed symptoms just over a year ago. Um, I don't know exactly why I developed symptoms. The theories include long COVID, bad reaction to a surgery. Um, yeah, so don't even know why, but I have been living with it for a little over a year, been struggling to get like help from actual medical professionals. I've mostly gotten help from people already in the community. And I have been doing remote school since I got diagnosed. What else do you want to know?
You touched on a big one, which I've never heard anybody say that they got POTS from like after having surgery.
Mm-hmm.
So, like, how did that affect you? Because you talked about getting surgery, and like, how did that affect you? And then you started feeling the effects. Like, did you ever think something was wrong, or?
So I developed unignorable pot symptoms, I'll put it that way,
Mhm.
about 2 weeks after I had surgery for something completely unrelated. Um, in hindsight, I know that symptoms like had kind of started to trickle in a little while before then, but that was when they became debilitating and something that I couldn't just say, I'm feeling a little weird. Oh well, moving on. And in my own research, I've learned that surgery can be a big trigger for messing with the autonomic nervous system, which is, of course, where POTS actually comes from.
That's really interesting. So, you talked about kind of all of that, but now you're talking about also like I guess having trouble getting in with doctors. I think that's the other thing of like what I
Yep.
know because for some people it's like, oh my gosh, it's been so easy for me to get in with doctors, and like I've had that experience of where it was really easy for me in the beginning of getting in with doctors, but I know like in Tori's case that's hard because you're having a hard time getting in to see doctors, and I know both of you are kind of having that same experience. So like but specifically for you, what has that been like over the course of like the past few months?
So, my whole like doctor side of the journey started off with several ER visits. Just because I was having debilitating symptoms, like unable to stand level. And everyone was kind of freaking out. Crap, I need to go to the ER, that kind of level. But of course, when I got there, most ER tests have nothing to do with POTS, and everything came back normal. And they were like, "Oh, it's just anxiety. You're just faking it for attention. You should probably go see a psychiatrist." All of like the standard medical gaslighting stuff, um, which of course created like a whole host of mental health issues on top of what was already happening. And eventually, I was able to get in with an actual cardiologist who, well, he didn't totally believe me. Like he did say at a couple different points in testing, like it seems like you're just out of shape. You may just need to exercise more, that kind of thing. Um, he did at least do the testing, which was good. That was how I finally got diagnosed. Was going through several different rounds of testing, and the normal tilt table finally coming back positive. And from there, I was sent to a different doctor. And then because I'm in college, I, of course, had to move. I'm originally from the Southeast United States and go to college at SLC up north. Um, which meant that I couldn't continue seeing the doctor down there. So I have essentially had to start from scratch in a totally new area of the country, um, with doctors that are doing the same game of like, oh, we don't actually believe you have POTS. We're not sure what it is, but it may not be that kind of thing.
Mhm.
Um, so basically, I have had no continuous health care. I was able to get in with someone long enough to get a base diagnosis, but nothing further than that.
So are you kind of just stuck in like this place of you haven't been
Mm-hmm.
able to basically.
Yep.
That's frustrating. I mean,
It's rough.
that's rough. Like not being able to get constant care and just I think especially because of also like the healthcare and like just and also the long wait times because it's unfortunate because there are a lot of people that are now coming forward and saying, oh my gosh, I have POTS too. So then the normal doctors that you would normally see, those wait lists, usually would be shorter of, oh, those doctors are booking 2 to 3 months out. Now it's like because I just had to join a post COVID POTS clinic through Stony Brook, and their wait list just they I was supposed to have an appointment next month. They moved me to September
Yep.
because
Oh my goodness.
they literally the doctor was just like starting to fill up with patients in person, and I'm not even going to Long Island in person. It's just I can't. They were like, we can't physically get you in between now and the summer. But the problem is for the specific clinic, you have to be in the state of New York to
Mm-hmm.
virtually be on the calls. They're like, you have to be in New York to be on this call, otherwise we have to cancel your appointment.
Wow.
So
Cute.
yeah, so they were like, what about September? I was like, well, I'll know I'll be back then. I'll be a junior and a whole and like close to a whole different age. But yeah, um, like that's crazy that
Mhm.
it's
Yeah.
taking that long, and also the access to finding doctors specifically in New York that can handle POTS is on the rise, getting harder because the good ones, like the nice ones and the good ones, are older and are retiring.
Mm-hmm.
Mhm.
So then the younger ones that are coming out of medical school don't know what they're talking about.
Yep.
Yeah, I think the other thing too is my cardiologist was telling me this, because he was like, honestly, you're kind of lucky you came to me. Not that he was like bragging or anything, but he
Hmm.
was like, a lot of cardiologists and even more just regular doctors don't even know what POTS is or they've never seen it like in real life. So like if you're lucky enough to even get diagnosed and have someone know what it is, they probably don't know as much how to treat it because now it's becoming a little bit more common, but for the past, years, however long these doctors have been working, they haven't seen it as much as or at all like they have now, since COVID and everything. So there's so many doctors and even cardiologists that really don't know what to tell you or don't know how to help if they even can come to the conclusion that you have POTS. So it's really crazy because it's like, all right, I know what I have. What do I do now? And it's like, well, I don't know. I've never seen this before, in my
Mm-hmm.
50 years of working or whatever. And it's like, what?
Yeah,
So how is that supposed to help? So just, I think that adds to the confusion and the frustration because a lot of people, even if they do believe you, they don't really know how to help.
yeah,
Yeah.
because like I went to a cardiologist like near my apartment building, and he was like, he's like, I only have like two or three other patients that have POTS, but I would describe this medication. Oh, but because you're this age and you're too young for it, and it could possibly mess with your reproductive system, I'm not going to give it to you because you're too young and because it can mess up your reproductive system. And then my parents drove me an hour to a POTS cardiologist that's like like the number one POTS electrophysiologist in the state of New Jersey. I went and saw him. Dude has like a whole ass book on POTS and like it's cut. There's salt everywhere in his office, but he's like the sweetest dude in the world, and has like amazing books and stuff. I have to share it with you, Catherine, after this. Um, but I went to him, and he was like, "You have all of the symptoms. Like, I'm not surprised." He's like, "Your chart." He's like, "Your charts are not." He's like, "I don't need to do the tilt table with you." He like we did all of the tests and stuff, and they like hooked me up to the EKG, and he looked at all of my previous stuff, and he was like, "No, you have POTS." He's like, this is what I'm going to tell you to do. You're going to come. He's like, if you're not better after 3 months, call me, and we'll put you on medication because he was like, I wanted, because he realized that the other cardiologist had under prescribed how much salt I was supposed to be on, which is why I was doing worse. So then he's like, no, you're not actually supposed to be doing 3,000 milligrams. You're actually supposed to be doing like 8,000. And I don't know why they didn't put you on 8,000. So he said he upgraded me to 8,000 and then changed my diet. So now I'm like, I was already gluten free and like all this other stuff. But with POTS, they're like, okay, now like besides having 20 plus food allergies, here's the diet you now have to stick to.
Mm.
And it's like I'm already limited with my options. You mean to tell me that I'm basically, unfortunately, gonna have to eat like a rabbit? Like, you're essentially saying I have to eat like a rabbit. It's like, yeah, just and to get your heart rate down. And but he was telling me about what plans and like protocols that he hates, because he's been studying POTS for the past, like, I think he told me 15 years, which I thought was crazy. I was like, you've been studying POTS for the past 15 years. It's like it's what he's known for at this hospital that I go to. Um, but he's amazing. I've had like one of the best experiences with him. And he's like, here's my email and my phone number if anything happens, and his team is awesome. But it just makes me so sad to hear like the different experiences of, like, because majority of my medical team is back in my home state, which is across the bridge, versus when I'm here in New York and I'm seeing my medical team here, and they're just like, anxiety. You just have anxiety, and like the medical racism gaslighting is real. So it sucks.
Yeah, no, it's rough.
How did you two, I mean, it might have just been in this class because of this podcast, but how did you two kind of meet and find out that y'all have the same condition? I'm curious.
It was actually funny enough
Yep.
about class. Yeah.
Yeah, Lauren was explaining. Sorry, remind me your pronouns?
She, they.
Okay. Lauren was explaining their podcast concept to the class with, like, oh, I have POTS and I want to talk about it. And I immediately messaged her and was like, hey, me too.
Oh, that's great.
There's a very large POTS community. Like, since the podcast came out, like, there's a very large POTS community at SLC. Just like people are like, I don't know if I should talk about it because, like, I don't know, and it's kind of scary. And I'm like, it's not that scary to talk about. It just seems like it. So the school just needs to start having. I'm gonna write a petition to get salt packets put in the bar, like right next to, right, because people will get like the big salt shakers and just like put it into their water. I'm like, y'all need to start giving individual salt packets, like you do it with like the lemon and the honey and the other stuff at the coffee bar. But I'm like, do the individual salt packets, or there
Yeah.
needs to be a little bowl of them somewhere, because like Health and Wellness gives out other free stuff, for like Sexual Awareness Month and all of that. It's like, no, POTS people during POTS month should have a bowl of salt somewhere on campus so we can get free salt, because like the passing out is not good.
Yeah.
I was gonna say, and especially like what do you feel like for you specifically, like also when you told the school, because I know like professors' response may be different versus like disability services versus like health and wellness. Like what was that experience like for you?
I have fortunately not met a professor at SLC who hasn't been supportive. And that just goes for like my entire time at SLC. We have amazing professors. On the other hand, I am fully remote at this point because the nature of campus. There's so much walking involved that I'm
The
like,
hills. I can't.
I couldn't do that. Like, I'm a part-time mobility aid user at this point. I use a cane frequently. Um, but like if I have to do that much walking just to get 3 meals every day, which is of course one of the times when I feel like crap the most.
Yeah.
No, that's just not an option. So navigating how to be a remote student because of the lack of accessibility on campus, that's been a nightmare. And I'm a senior, so this entire time I've just been like, I just need a handful more credits to graduate. That's it. Please work with me to find a way of making this happen. and it has been a struggle to just like get a couple credits at a time. It's like, well, if you guys were more accessible in this other way, we wouldn't be having the argument, but here we are.
Yeah. So do you feel like I don't know if you had heard about POTS before all of this. Like me personally, I remember seeing some people on TikTok talking about it and thinking like, wow, that sucks. I would like hate to live that way. And like a year later they were like, hey, by the way, this is what you have, which is like super ironic. Not that like, not in any sort of, well, I guess yeah, in a negative way. I just remember thinking like, man, like that sucks. I didn't know much about it, but I remember seeing people on TikTok like showing their fainting episodes and stuff, and you know, kind of knowing a little bit about it. So do you feel like, did you kind of know a little bit what it was before they told you, and then after they told you, how did you go about kind of researching that?
I had never heard of POTS
Mommy Leslie
before.
Clark.
That was my mom. Sorry, I forgot. I forgot to tell her I was in the middle of an interview. Go ahead. So sorry.
That was great.
That was hilarious. Oh my gosh. So sorry.
Robots and mommy in the background. I'm like,
Yeah, no, because that's what I have my mom listed in my phone, so that way, like, if I were in a medical emergency, people would know, like, oh,
Mm-hmm.
it's my mom. Oh, she's about to start a panel. That's why she was calling me.
Nice.
Oh, but you guys can go ahead.
Cool. Yeah, I had never heard of POTS before. I was pretty familiar with long COVID and MECFS, so I kind of knew about some chronic illness adjacent to POTS. I first heard about POTS actually through a friend of mine who's pre-med who like texted me one day like, "Hey, I just learned about this in my class. This sounds so much like the symptoms you're having."
What class? I would love to know what professor is teaching about that.
Different school.
Okay, I was like, what professor at SLC?
No, different school, sadly.
Darn.
Right? But no, my pre-med friend basically diagnosed me before any doctors did.
wow.
So I just text her all of my chronic illness questions at this point. I'm like, you have a better track record than the medical community.
No, I do the same thing.
Yeah.
I like half of my friend group is like pre-med or poli-sci, and so my pre-med friends, I'm like, hey, it's like I'm having
Bestie.
a POTS flare, and I don't know what. Like my main friend that's pre-med now just keeps salt packets on her because she started doing research on it for her class, and so she's like, "Did you elevate your legs today?" I'm like, "No."
Yeah,
Like, I did
I'll go
honestly,
do that
that's why I
now.
just text Lauren. I'm like, Lauren, you're the only person I know to talk to. Do you ever have this problem? And she's like, what?
Yep.
Half the time I text you, you're like, I don't know about that.
I'm
You
like
feel like,
that. I'm like, and then I'll like literally, you'll text me and I'll research it, and I'm like, that's POTS. I don't know what you're talking about though, but that's POTS.
I don't like, hey, you've like experienced this before, right? And you're like, get some help, please.
Like get checked out. My gosh.
No
That's not good.
skills whatsoever.
Mm-hmm. But yeah, basically all of my knowledge has come from exactly that. Because the other big thing for me was I started getting on like chronic illness Instagram and TikTok from
Me.
while I was bored in the ER waiting to see a doctor. And then 9 times out of 10, I didn't actually go to the ER like 10 times, but figuratively, I would leave the doctor's office with more information from whatever time I'd spent watching different
Yep.
reels than I did from the actual doctor.
Yeah.
Yeah.
That's funny. No, I think one of the bigger things that like nobody talks about is with POTS, you can't get sick. It's the same thing of like when you're going through, for example, with like chemo treatment, and if you have cancer, like you can't get sick. Your body immediately becomes immunocompromised. And because I got diagnosed with POTS in February 2023. After that happened, I went into a sick cycle where I went to the hospital 10 times
Oh,
last year.
jeez.
And like and they were like, you don't have POTS, and I was like, I have the doctor's note right here. And like I went to the hospital, I think it was like a couple of weeks, like a couple months ago, This year though. And I went to the hospital, and I was having really bad chest pain, like to the point that it looked like I was having a heart attack. Like all of my symptoms looked like I was having a heart attack. I was like, all right, this is it, we're done. Like, I this is it, it's game over, man.
Mm-hmm.
And they couldn't figure out why. And I did not get a cardio. This is a hospital where a medical team is, but the hospital was so crowded, um, because this was during like American cardiac like heart month, and so it was old people all having heart attacks, and so it sucked because I wasn't able to get a cardio consult whatsoever. And they were like, we can't figure out what's happening with you. We're so sorry. Like, I don't like we're so sorry. Like, we wish we could give you something else. And then weren't going to give me an IV in the hospital. They were like, well, you don't really need it. Like, we can kind of just send you on your way, even though like they did the EKG and all of the stuff. And I was like, I will feel like crap if y'all don't give me this IV. And then they did. They gave me the IV, and luckily my mom was there. I'm so glad my mom came, because I don't think if she hadn't, um, I don't think I would have like and I also like they also diagnosed me with like silent seizures, and the hospital connected to my POTS while I was in the
We
hospital.
have to talk more about that at some point.
Yes, we can touch on that in this episode, of essentially like I would be talking with her, and I would just like start like it looked like I was almost in a trance, and then I was in like she was sitting with me because I was sitting in like a wheelchair, and I legit just went and fell forward, and she caught me, but like
Oof.
and then she would try to wake me up, and I wouldn't wake up, and she was like just shaking me, like trying to shake me awake, and then I'd wake up, and I'm like, what happened? She's like, do you remember anything I just said in the last 5 minutes? I'm like, no. So,
Hmm.
and that happened frequently while I was in the hospital. I was in the hospital for like 7.5 hours. That happened like 5 more times while I
Phew.
was sitting in the chair. I was like, that's not good. Why is this happening? And they're like, we don't know. But now they want me to see a neurologist. It's really
Yep.
hard to see a neurologist when everybody has POTS,
Mm-hmm.
because the 5 different types and not knowing the difference. And so, but you said you wanted to touch more on the silent seizure thing. Is that something like you have dealt with your POTS?
TBD.
Yeah.
Currently getting tested.
Ooh.
Um, yeah, no, since moving and having to like start from scratch anyway, I started off with a cardiologist down south, and then a lot of my symptoms have been very like I don't know how to describe it other than seizure like symptoms. I'm not sure if it is a seizure, but it sure as hell feels like it.
Yeah.
Um, so when I got up here, I'm like, well, I'm going to try and get in with a neurologist. And yeah, I am now like going through different testing for other stuff. And that's something that I've learned is like fairly common with POTS, but no one talks about. Is that because it's your autonomic nervous system going haywire, like seizures aren't uncommon with that.
Yeah. Which, like, I know, Tori, from your experience, you told me like your POTS kind of. I remember when Tori texted me that's what was happening with her, and I was like, I've never heard of that. And then I started going on TikTok, and there were people on TikTok talking about them having non-epileptic seizures, like just dropping in the middle of like the hallway of their school and just seizing, like, and they can't stop it.
Yeah.
And but it's like, they have POTS, and then it, and POTS is always like core morbid was something else. So
Mm-hmm.
they were like, it's POTS and it's EDS, or it's POTS and
Hmm.
forget what mast cell activation syndrome, which is like
Mm-hmm.
the other thing that I
MCAS.
have. Yeah,
Yeah.
MCAS. But I've had MCAS like my whole life. So it's just seeing like the comorbidities and like just how it's affecting people, specifically like people who are having the seizure types. Because for some people, it's just like, oh, I'm just gonna fall forward and I hit my head, which is the worst part. Because if you don't hit your head, then you don't have to go to the hospital. If you do hit your head, then you have to go to the hospital because they think you might have a concussion. Um, so it's not fun at all.
Yeah. That's another one of those times where, like, I'm like, you know what? I'm a little unsure about this. Let me text Lauren. It'll make me feel better because she'll be like, oh, yeah, I have the same thing. But every time, I swear, she's like, nah, I don't know what you're talking about. Maybe, like, check that out. I'm like, well, dang, I was about to, like, and for me personally, I'm not really in the financial situation to, constantly be going to doctors and stuff. And, my cardiologist, because of the different shaking and seizure like symptoms I have, he was like, I would love you to go see a neurologist, but that's not really realistic for me right now, especially because I know that even if I could if I was available and able to go to one appointment, it's never just one appointment. You got to do tests, you got to come back. It's got to be like a whole ordeal, and half the time they still don't even have an answer. So it's one of those things that a lot of people, are not able to constantly go from doctor to doctor to doctor, especially when half the doctors don't even know what to tell you or they just charge you and send you somewhere else. So it can be very frustrating because it's like, well, I still don't know about this and this and this, but I mean, what am I going to do about it? Because I can't just ask someone and then casually diagnose me. You have to go through the system to
Yeah.
get answers. And then you may get answers, and then it'd be like, well, you can kind of treat it, but there's not a lot you can do. You kind of just have to live with it, which is what POTS is. And
Yeah.
I'm really lucky to where I have people in my life that are very, very good about being patient and taking care of me and helping me out when I can. But it still very much sucks because I wish there was something I could do to just like take it away. Just live like a normal person. That'd be great. But I do feel lucky at least that I was diagnosed because I know there's got to be so many people that have not even been diagnosed because of all of the issues trying to get to the doctor.
Yeah. I think that's like the biggest thing of getting in with the doctors, and then it's the aftermath of, okay, now you have POTS. Here might be some other things that you're about to get diagnosed with right after. Because I was diagnosed with POTS in February of 2023. By October 2023, I added on two new chronic illnesses already. And
You're
then
collecting them
in
like infinity stones, girl.
I know. Listen, I need to start adding colors for them. And by November 2023, the hospital that I was going to getting genetic testing called me, and they were like, "Hey, so you have this disorder that's connected with your POTS, and you like probably 50% chance probably can't have children. We're so sorry." Um, and I was like, I don't understand. I'm like, I want this to go away. Is there anything that I can do? And they were like, well, the medication that we would put you on, and I'm very happy that like I'm going to like an advanced like type of OBGYN who knows about POTS. And she was like, the medication that we would put you on would affect your vagus nerve and your reproductive system and your autonomic system, and basically send your body into shock, which isn't good for you. And we're like, we're so sorry. There's more that wish we could do, and we should probably have you come back in for more testing. And I'm like, you've got to be kidding me. I'm like, I've already had like 10 hospital trips, the chronic illnesses of the world, and now this. It's like it was just one thing after the other, and it kind of sucked because it was kind of just like a blow to the stomach, and I was like, I wish there was more that they could do, and they're trying to figure out if there's more that they can do and seeing if they can send me to like the Mayo Clinic or something to see if like I can get better. But even just going to the Mayo Clinic alone, I would have to take time off to go to the Mayo Clinic and stay in that state for months to get seen. And I've had my doctors tell me, you just need to go to the Mayo Clinic. It's like, I don't have time to go to the Mayo Clinic, like, because the Mayo Clinic has one of the like top pot studies in the world. They've been studying this since like 2010. So they've been doing it for a while, but even just getting in now, like, you have to basically pick up your life and go stay, and then hope that you get all of the stuff that you want in a week, and then hope that you'll be fine when you come back.
Yeah.
Like, it's just not it's
And
not great.
you mentioned how, because I remember we've had this conversation before where your doctor specifically did not want to put you on medication for this. And, Catherine, you definitely don't have to share whatever medication you're on. But you can jump in if you have any thoughts on this, but I think it's interesting because I am personally on a medication that I was actually on before because it can be used for panic attacks because basically what it does is
Mm-hmm.
it slows down your heart. So I've been on it before, but now I'm on it specifically for POTS. So like a few minutes ago I just took 3 of them, which I don't know if that's too much, but so far I've not died, so probably fine. But, when my heart gets a little too high, I take a few, it goes back down. But for the first time the other day, because I have like this little like pill container that I carry around with me and have all my little pills like a mom, but like
Mm-hmm.
normally when I get it, I like just dump them into that thing and then I throw away the container. And for the first time the other day, I was looking at the container and the main side effect of that medication is dizziness. And I was like,
What?
what? So, like, the
Yep.
whole reason I'm taking it, or at least like 90% of the reason I'm taking it in the first place, it just increases, honestly. And so, but also, I mean, it's one of those things too where Lauren, we've talked about this before, is you're not really missing out on too much because yes, it lowers my heart rate. Like earlier sitting down I was at 130 and right now I'm at 80, which is great, but I still feel the same. The only difference is that my heart is beating slower and my chest does not hurt as much as it did. So like
Yeah.
ultimately it's not really the answer. Which is
Mm-hmm.
just another one of those things, it's like, well, hey, we can treat these symptoms, but there is no like, do this and you'll feel better. Besides the like drinking way too much water, um, which is kind of unrealistic for especially college students.
Yeah,
Um,
they're like, drink a gallon. And it's like, you want us to drink a gallon of water
Mm-hmm.
a day? I
mhm.
was like me drinking water alone, like I can't drink, like I already wasn't drinking enough water because my stomach would start hurting if I drank too
Yeah.
much
Yeah.
water. And
Yep.
they're like, just keep drinking water. And like my mom's like, you're not getting enough water. And I'm like, my stomach is hurting and I feel like I'm gonna vomit. I'm like, if I don't stop for like 15 minutes to let this get through my system, then I'll start again. Like I literally have to sometimes sit and drink water in 15-minute increments. Like I will have to set a
Yep.
timer and be like, okay, like I drank how much water I could. Now I'm gonna wait 15 minutes, let it process, and then do it again. Um, like it's really annoying. It's so annoying because you want to be able to be healthy and like you want to be able to do all this stuff, but it's like it's hard, especially when with pots of having to also increase your salt intake. And
Mm-hmm.
but like I got put on the rice diet like a couple months ago and they were like, "Oh, but you have to decrease your salt intake." I was like, "I can't do like I was talking with my doctor. I was like, "Dude, I can't do that." I'm like, so I never ended up going on the diet. I was like, I can't limit my salt intake. I'm like, "You're asking me to do something that basically keeps my body upright, and basically lets me walk around on campus despite the fact of those gosh darn hills." I swear, if Sarah Lawrence, I'm just glad that they're moving the main like place that I hang out further up on campus, so now I don't actually have to like walk all the way down to the bottom of the hill. Um,
Yay.
so very happy about that.
I hate
Um,
hills.
our school is basically just all hills,
Mm-hmm.
That's
and
my school too. I'm
yeah,
like, every time I see someone with a bike, I'm like, how did you get here? Because I know you did
yeah,
not ride up these hills.
yeah, or like a scooter. Like there's one guy
The
on our campus that like has
scooters.
like he's scooters everywhere. It's not, but it's like one of those like rolling scooters. There's some guys that will like skateboard, and I'm like, I don't know how y'all do it.
Like, how'd you get
I
here?
don't know how y'all do it. Yeah.
Yeah, I have
Like,
like
what do
a
you
joke
mean?
about
You just,
people
you
with
just,
scooters because on my campus, like, they will run over you. Like, you better watch out for yourself
Oh,
because, like, someone will come on a
yeah,
scooter like
same.
100 miles an hour out of nowhere, and you're like, oh my goodness, like it's an active hazard.
Yeah. I think the other biggest thing that I've also had to deal with is like people gaslighting me on campus. Not like
mm-hmm.
health and wellness, but like campus safety. Cause like
Yep.
I got a medical safety card from health and wellness. And this was like I think like after I got diagnosed with POTS, and I called and I was like, I need medical transport to yada yada yada. And they were like, well, you don't look injured. I was like, I have
Well,
POTS. I was like, so I called up the head of health and wellness, who was like, I consider the saint above all being. Like, she's literally the most amazing person of all time. Like, I go, like, whenever I have medical emergencies, like, I skip over whoever, like, the RNs are. I'm like, I just need to talk to her. She's like, well, they're like, well, why do you need to talk? I was like, I just need to talk to her. She was like, if you just say my name, she'll know it's me. Like, I will just go over to health and wellness, and I'm like, it's me. And I'm like, just call her up, please. And she'll come downstairs, and I'll be sitting there. She's like, okay, what is it this time? Pots flare? What? Like, do I need to go grab salt? What is it? Like, she just knows by now, what's happening. And so when I told her that campus safety was gaslighting me, she gave me a medical card and then called the head of campus safety and was like, listen, I'm
Oh,
not
that's
thank
playing.
God.
I'm not doing this. This child has POTS and can't walk up these damn hills. Um, but I'm lucky because my parents, when they found out, that my POTS was getting worse, one of my parents came to stay with me. So they've been with me for the past couple of months. Um, just to monitor like my POTS symptoms because it's been all over the place. And so um yeah, but I was going to ask you, Catherine, specifically with disability services, since we lost our disability service person, a couple months
Mm-hmm.
ago.
Mm-hmm.
What has that been like for you, and like
Ooh.
navigating the I mean, could you talk about being remote, like fully remote, which I
Mm-hmm.
also want to know how you're doing that because I kind of want to explore that, and how that's like working for you specifically.
Yeah, so I am fully remote with the health advocacy program. I likely would not be able to do that if I wasn't already in my senior year and just getting the last few credits kind of a deal. Um, so it's not like technically an offer. It's
Yeah.
just something I've kind of pieced together. Like, here's a remote class and here's a remote class, and I'm just going to do it this way because this is the only way I can keep my life sane right now.
Yeah.
Um, but yeah, I basically found out like in the past 18 months of all of the different disabilities I have. Some of them I've had my entire life, some have developed, but I've only learned about them in the past 18 or so months. And yeah, the biggest complication thus far has been dealing with the medical gaslighting and how that works with disability services, since typically they need some kind of documentation of it. That several times I've had to be like, I know you need this documentation. I would love to give it to you. Most doctors I see don't believe me because I'm a young woman and it must just be that I'm on my period or something. So, how do we want to handle this? Because my other option is to leave school. Like, I don't have choices when it comes to my health. Um, yeah, it always to me just seems to go back to the issues with medical gaslighting.
Because medical gaslighting is real and
Mm-hmm.
medical gaslighting sucks.
Oh,
Um,
yeah. I
but
wrote
I
an
mean,
entire paper on it.
I would love to see that paper at some point.
I will send it to
Um,
you.
but I just feel like I feel like the experience is different because I've talked to other potsies on campus who specifically
Mm-hmm.
had to deal with their disability service person before he left, and so like what options were you able to at least get during his 1 year stint
Mm-hmm.
while he was on campus?
Um, not many
Yeah.
is the answer. Yeah. Any significant option that I've had come through that is like fully an accessibility thing. Because, like I said, a lot of the remote work has been just kind of me piecing things together and them saying, we don't have a rule against it, so like go ahead. That's weird, but whatever. Um, but any official option, like I now have a screen reader from the school because my brain fog is so bad that like I can't read more than 2 pages at a time before I have no clue what the words are. Um, that has all come through in the past couple months, since we got some new people
Yeah.
doing that work. So it's been a struggle to get the accommodations I need, some of which has meant that I have gone on medical leave a couple of times because I'm not able to do the work without accommodations that aren't coming through.
Yeah. I just like I part of me also like feels bad that like I wish the school could do more, but I also know that they don't know enough about it. Like cuz I and then that was one of the things I was talking about with the head of health and wellness. She's like, I wish there was more I could do. She's like, I'm still understanding it. And the POTS cardiologist that she had recommended me to in
Mm-hmm.
Bronxville had to stop seeing patients because she developed POTS herself. Yeah.
Oh,
I was like what do you mean? And I was like and like my mom called me one day. She's like, oh, remember that doctor that you planned on seeing? And like she was in like a my mom also joined like all of the POTS moms Facebook groups. I love my mom, but like she
that's
literally
so
joined all of the
sweet.
I know, like she joined all of the moms POTS Facebook groups, and she found one for New York and like specifically my area. And she was like, oh yeah, like the doctor ended up having to like stop seeing patients altogether because she has POTS now, and now it like has to manage it. And I'm like, what? Like that's that's crazy.
Mm-hmm.
Because I think just having to deal with POTS like in general, and then you also mentioned that you're a senior, so
Mm-hmm.
like have going into senior year, and then also having to look for jobs post grad that may possibly be
Yep.
accommodating, which I'm sure hasn't been easy. Um,
No, God on high, no. No, I'm pretty
um,
much taking the attitude like, I guess I'm going into disability theater because I don't think corporate America wants me anymore.
yeah. Because I mean, just even like I worked a corporate job last summer, like just doing videography from home, and even just doing that, like I would sit up at a desk and things like that in my apartment, but I just remember being like so tired, and
Mm-hmm.
like I was like, but it was a 9 to 5. Like that was the worst part. Like I could take breaks and things like that, and my mentor was the head of HR, so thank goodness, like I was fine because she's like, is your POTS flaring? Like, are you okay? Like, do you need to take a break and things like that? So she would give me mandatory 15-minute breaks. She's like, if you feel it coming on, she's like, hop offline, go do your salt, go do your water, and then come back in and check with me later. And so she was amazing, but I just specifically with corporate America, like I still want to do film, but it's hard. I feel like unfortunately the film community, like being on a film set, is more accommodating than corporate America, because i
Yeah.
was i was assistant cameraing on a film last summer, and I almost passed out, so they brought me a chair and moved the monitor in front of the chair so I could keep autofocusing from the chair, and like just put a cup of water like right next to my chair so I could keep autofocusing, because they're like, we don't want you to pass out. So
Mm-hmm.
and they just hired me to work on another film this summer, and so I was like, oh yeah, I have pot still. They're like, okay, so just tell us what you need first before like filming starts, so that way we can like be prepared.
That's so
um
sweet.
yeah, I love working with them. It's like a team that I've been working with for like almost a decade now, like in film, and they're awesome. But that comes from they've known me since I was a kid. Like they've known me since I was like before all the chronic illnesses, before COVID, and all of that. So it comes with time and also patience, and like they know my family, and so just all of that is patience and time, and like them getting to know us. But I mean, I know you're working on your project in like disability theater, which is like
Yep.
really cool. And just have you met anybody else, I think, like besides me, and now besides Tori, that also
Mm-hmm.
has POTS, and like but is also doing like theatrical or like stuff in the arts or things like that, who are dealing with kind of the same issues.
A couple. I am actually working on a show right now where one of our other actors has POTS. So like they were having a flare the other day, and I was just like bringing out my salt collection from my room and putting it on a communal table. um, um, and then I've been working with one director who doesn't have POTS but has been insanely accommodating for me. with a lot of similar stuff to what you were talking about. She knows that during a break, if I'm like laying down on the floor with my feet up against a wall, that it's fine. Don't worry about me. I'm just doing my thing. Um, and then I've met a couple of other people who are professionals in the industry at this point, who I don't know all of their actual diagnoses, but are spoonies. And a lot of them also work in some level of disability film and theater, since you have to be with people that are actually accommodating in order to make it work.
Yeah.
Mm-hmm. So, Catherine, what would you say, as we kind of wrap up? Like, what would be your word of advice to anyone, whether they're in the arts or not, anyone who has POTS or dysautonomia? Um, what would you say to them to kind of encourage them or give them advice?
Um, I think the biggest thing is that you know your body better than anyone else does. No one has lived in your body as long as you have. Um, so talk with the other people in the community because they have the best advice, and believe yourself. Like, even if the doctor is medically gaslighting you, you know what's going on. You may not know the official like medical details of it, but you know when something is wrong. Trust that. Surround yourself with people who trust you, um, and start listening to your own like gut and voice, and that will solve a lot of the accessibility problems that exist.
Mm-hmm.
I agree with that heavily. I agree with that heavily.
Yeah.
My brain also, like, it looked like I was in a trance for a second. I just had brain fog and had like a mini silent seizure,
Yep,
but
You
it's
need to
okay.
go lie down,
I feel
maybe?
that.
Yeah, probably do.
I feel like
Probably
as soon
do.
as we hang up, we're all gonna go lie down.
Yeah.
Oh yeah,
Yeah. Oh yeah.
definitely.
Oh yeah. Oh
Mhm.
yeah. But thanks everybody for another wonderful episode of Dizzy Directors, and we will see you guys again for episode 5 pretty soon. Bye.
Bye!